Hi, my name is Cheryl. I am 65 years old, a patient of Dr. Daluvoy's, and I had a breast reduction. The time that I thought about doing this breast reduction, it was in 2018, and I set up a consultation with him. He was recommended to me by someone, and he said I was a good candidate because I was heavy chested, I was a size 34N, and I was having back pain and neck pain. So I told him, okay, let me think about it. And I got nervous about the whole thing, and I just felt I had family obligation. It wasn't the right time for me. So let's fast forward 5 years later, 2023, I came back to it because the pain had gotten worse. I had neck pain, shoulder pain, back pain, and I had indentation in my shoulders. And so I called to make the appointment, and he remembered me. It's crazy what he did. And he said, yeah, let's go for this. He went over in his consultation exactly what he would do as he did the first time. He showed me pictures. He told me what the surgical process would be, and said that I would be in great hands. I had no need to worry. At that moment, the pain was so bad for me. I said, let's do this. I didn't want to think about it. Let's just move forward. So we set up an appointment with the patient coordinator, Whitney, who was wonderful. She answered all my questions, and after we set up the appointment and my pre-op and all the things that I need to do, she said, feel free to email me. You can ask any questions. And I said, okay. I must have emailed her 10 times. So, but she was so sweet. She answered every question I had. And so then I set up the appointment. This was in November 23, I had the consult. We set up my surgical appointment in February of 2024 on the 23rd. And as time got near, I was a little nervous, but I was excited because I knew I would have relief from this pain. And I thought it would be a nice birthday gift, as my 65th birthday was March 23rd. So I figured, what a gift to give myself. So we went through the pre-op instructions. I had to have an EKG, mammogram, and blood work done. It all had to be done within the year, except for the EKG. I think the EKG was a year, and then the blood work within 3 months. And so I had all of that because I had just had a physical, so it worked out well, and there I was ready to move forward. So the day of the surgery, I came in, and this is the process. You come in, the nurse, who was Anna Catherine, who was sweet as a pie, she came in and she went over what was going to happen, preparing me for the surgery, and then she went over the aftercare, and my husband was with me, so she explained to him what he would need to do during the time I'm at home. Then the surgical tech came in, Amy, sweet too. She told me, we're gonna get you ready, go in the bathroom, change your clothes, and they gave me this beautiful robe. I felt like I was at home, and came out, and she told me, you're gonna meet the anesthesiologist. He's gonna come in and talk to you, tell you what he's gonna do, and then I'll come and I'll take you to the surgical room. So the anesthesiologist came in, he explained what he was gonna do, prepared me for the procedure, and he gave me some medication to take prior to going to surgery. And he left, and Dr. Daluvoy came in, and he made sure I was at ease and was ready to go, and I told him yes. So then he had me to stand up, and he'll do markings around the breast so that he knows exactly where he wants to do the incisions. So he got me ready, and once he did that, Amy came back and got me, and we went to the surgical room. And let me tell you, everybody was amazing. Amy stood there by me. She held my hand. She says, you're gonna be great. You're gonna be so happy after this is over. We're gonna take good care of you. And when you wake up, you'll be fine. Hopefully you won't have much pain. And I said, okay, this is good. And then Dr. Daluvoy came in and he said the same thing. He said, let's get ready for this. You're going to do great. I got you. I'm going to take care of you. You don't have nothing to worry about. And I was like, thank you. You just put me at ease. So next thing I knew, I was out in recovery and they woke me up. The nurse got me ready to go. Dr. Daluvoy came in and said, everything went great. He explained to me that they were gonna take my breast tissue. They're gonna have it tested. I agreed to that. And he told me he got about, believe this or not, but about 8 pounds of tissue was removed from my breast. I was stunned. I was like, oh my goodness. So, but he said, you're gonna be pleased. I know when you see it, you're gonna be pleased. And the other thing I wanna mention too, because I was so heavy breasted, I had to have what's called a free nipple graft. And that's when they remove the nipples and remove the tissue and then put the nipples back on. And the reason I had to have that done, because I was so big, he wanted to ensure that the blood would flow to the nipples and the nipples wouldn't die. So that was the purpose of doing that, to ensure that would not happen. And I tell you what, when I saw my new breasts, I couldn't believe the nipples had been removed. It really didn't look like it had. And it was just amazing to me. And so he was pleased, he was happy, I was pleased. The recovery process, it takes a couple of weeks. You know, you have to make sure after the first 24 hours you get up and move around because you don't want to get blood clots. I really didn't have a lot of pain. The pain medication really worked well. I only stayed on it for 2 days, and after that took extra Tylenol, which worked perfectly. And I listened to doctor's instructions. I will not do anything he tells me not to. So I couldn't lift anything over 10 pounds, and I couldn't lift my hands above my head. So I did exactly that, and I came back. I did have drains. I came back after 10 days, and they removed the drains. And once the drains were removed, then I came back for a 4-week checkup, and everything went well. So, ladies, I have to tell you that after this surgery, I built up more confidence. I felt beautiful. I had never felt that way before. And I can't tell you the happiness I felt. And so, if you are considering this, this will be the best gift to yourself. It will make you feel better, look better. My clothes fit so much better on me. And I know I will never regret that I did this. And as for the team here at Specialists in Plastic Surgery, they're like a family. They treat you like family. They're all wonderful, from the front desk, Keely and Maya, to the nurses, to the surgical tech, surgical assistant. Beth, she came to see me after the surgery because she wanted to see how they looked. That was funny. But it's an amazing experience. And I'd highly, highly recommend Dr. Daluvoy and Specialists in Plastic Surgery.